We're always going back to the electrical current. Main reason on this guy is of the energy we're making, 90% of it is coming from oxygen. And how we're using that oxygen is super, super important, okay? So whenever you're seeing somebody or you're trying to explain the program, or you're working with a client, or yourself, you're working on something, always be thinking about, what is my power plant like? And how are those fuel resources? I think this is a coal plant. You can see the coal over to the right, I think. You know, how's my resource that I'm making the energy from looking like? And when it comes to oxygen, that's our #1 resource. The other resources, of course, are hydration and nutrition, and those are very important. I do feel like many times people get down those roads in some real micro levels, and those are very important, but the person doesn't even know how to breathe. That is exactly why when we do EEG, we don't just deal with EEG or neurofeedback on its own. We always integrate that with breathing. So when we look at the different things that are able to make this whole machine run, and this is a pretty amazing thing, this 3.5-pound organ called the brain consumes about 20% of the energy you're making. So think about that for a second logistically. You know, let's say you're 150 pounds, you got a 150-pound person, 3.5 pounds is the brain. That's not a lot, but yet it's consuming 20% of the energy you're making. So every time you breathe, 20% of that oxygen is going to your brain. Every apple you eat, 20% is going to your brain. Every glass of water you drink, 20% is going to your brain, okay? And so we want to make sure that fuel supply is really, really strong. The other thing that we want to be thinking about when we're looking at the fuel supply is also all the different neurons and neuronal activity that's going through the brain. So the power is made, and then it gets distributed throughout the body through neurotransmitters, over neurons, through synaptic pathways. And in between all of these pathways, there's a little gap called a synaptic cleft, and the neurotransmitter is what transfers the electrical information from one neuron to another. And many times when we're working with people and behaviors, we're always looking at, well, how can I change some of this electrical activity to change behaviors? And there's two different ways that we can change that. One is I can put some chemical in between those neuronal connections, and it'll actually change how the brain fires the electricity. And that's referred to as a ligand-gated change, when you're changing electrical current. The second, through chemical, through an external substance. The second kind of change that happens is the neurons can actually learn to become more efficient. They can learn new pathways. They can actually have parts of the brain that are dead, but yet they find ways to still function and adapt. The beautiful thing about being a human is our ability to learn and our ability to adapt. And this adaptation comes through learning, which is referred to as a voltage-gated change. So your neurons can literally fire the electricity differently based on things that you learn over time. Okay, those are voltage-gated changes. So I can learn to focus through a voltage-gated change, or I can chemically alter focusing through a ligand-gated change or a chemical change. But all this is doing is always going back to the electrical current and trying to adjust its firing. And so we've talked about this next piece is that in the firing, we work through what's called the autonomic nervous system. And the autonomic nervous system is constantly deciding how I'm going to use that electrical current. Am I going to go super, super fast, or am I going to go really, really slow? Now, when I talked about this ligand-gated and voltage-gated changes, the learned patterns, which is the greatest thing that we can do as a human, is our ability to learn, is learn changes in the autonomic nervous system, where I can literally move it into a parasympathetic or a sympathetic state. Many of our clients who come to us that are experiencing difficulties have learned habits that have moved their autonomic nervous system into a continual sympathetic state or a fast state. If I gave them a chemical like Xanax, that would slow down their autonomic nervous system, which would be a ligand-gated change, and they might experience some temporary relief, but we haven't created a permanent change, which is a voltage-gated change that actually reteaches the nervous system how to get out of that sympathetic state and how to get into a more balanced state. One of the best things for this, right out of the chute, is breathing. The breathing and HRV. So a lot of times in EEG feedback, that's going to take a while for that brain to learn a new habit. And the reason why it does is the brain doesn't want to just change at any given thing, information that's given it. So it waits over time before it reacts to the neurofeedback. Typically, we see that right around 10 to 15 hours that it starts to make this exponential change. But in the meantime, what can cause almost immediate relief for people is helping them learn to change their oxygen flow and improve their heart rate variability. So when we look at heart rate variability, we went through this last week. You'll see the up and down beats of the heart in your screens that you'll be using. And what makes that heart rate bar go up is the increase in the interbeat interval. So when we're out of oxygen, the heart then starts to beat a little bit faster. The vagal nerve stops its activity for a moment while the heart works faster, and then once it has oxygen, then all of a sudden the beats become longer, and that's when we get more relaxation in the heart. And that's what you see here represented in these dots that become very narrow the distance as they get to the top. But once you've given them oxygen in a breath, they start, the interbeat interval in the heart becomes wider, which is a more relaxed state. And our key is to create a balance. So let's go to the next area. We've looked at this before, but I want you to be very familiar with these. And here is a screen where somebody's breathing and heart rate is completely out of sync. The stress on their heart is 56. Coherence, which is the synchronization of the two, is way out of sync. And we want them to look more like this, where here now the breathing rates are very stable, the oxygen flow is normal, or in a more optimal zone, and then the heart, which is the red line, starts to beat in synchronization much better. Okay, this is really where we're going. Now at this point, even the person who's has maybe a lifetime of anxiety, they're going to be able to adjust their autonomic nervous system based on this. Okay, let's go to the next slide. So before I kind of do a live illustration, here is a chart from HeartMath, and this is showing that when people improve their heart rate variability, okay, which many times they can get that coherence up into 85 or 90. When they can start to get in that range, which the average person that we've seen in the last 20,000 people that we've assessed that come into a clinic will have a heart rate variability or a coherence of right around 35. When you give them training and they learn to get their HRV in the 80s, these are the kind of changes that you see or that they'll report. This is without even doing any form of EEG feedback. This is just breathing. The reported numbers that you'll see in focusing, when you're measuring focusing objectively, is 25%. Sleep improvement, 30%. A sense of calm, 38%. Reduction in anxiety, 46%. Reduction in symptoms of fatigue, 48%. And then depression, 56% reduction. Okay, these are this is why we spend a little time on HRV, and this is why I want you when you're working with people is don't just fly right on by the breathing and heart rate. Sit here and rest a while, because you'll be amazed at what can happen to people when they learn to breathe and get their HRV in an optimal spot. So these are huge numbers. I mean, just think about if you put medicine up against this, it's not even close in all these different things that it's doing. Because typically you're going to have to figure out, well, what am I going to do to increase focus? Well, that's going to probably be an amphetamine that amps the system up. And what happens when I do that? Well, now they're going to have a reduction in sleep quality because I'm going to have to time that amphetamine out just right so it's not in their system when they're trying to go to sleep. So to have both a focus and a sleep improvement is next to impossible unless I start to get into some polypharmaceuticals. So now I'm going to give maybe an upper in the morning, some amphetamine in the morning, and then something to slow them down at night, a Valium derivative or some type of sleep aid, which now I've got two medicines on board. Then there's a sense of like calmness, which could be from a serotonin or something like that, which you're looking at an SSRI or something in there that might do that. The reduction in anxiety, but then at the same time, reduction in fatigue. So a lot of times these medicines slow people down and they're less anxious, but now they're putting on weight. They're less interested in maybe getting out and doing things, and they might have some fatigue. Yes, they're not experiencing the deep level of depression they experienced before, but they just might not have those ups and downs that actually sometimes can be good for them, the ups. And then to also have the reduction in depression of what we're seeing at 56% is pretty significant. So what I want to do is I want to draw some things up on the board to explain specifically this last one on depression. Okay? So you guys hanging with me? All good? Everybody's muted, so I'm just assuming you're saying you're good. So
all good, Dr. Royer.
Good. Okay. So let's talk about this whole idea of depression decreasing by 56%. Okay. This is really fascinating. Okay. When you think about depression, is by the year 2025 supposed to be the leading cause of disability in the world. Okay. The leading cause of disability in the world is depression. Back in the late 80s, when the SSRIs hit the market, Front of Time magazine said that we would eradicate depression in something like 10 years with these SSRIs. Well, as many of you know, it's actually increased 3 to 4-fold since then. So we really haven't found the solution for depression. In pediatric circles, where I've done a lot of work over the years, depression is referred to as the great imposter. Okay. And why do people call depression the great imposter? Because it hides itself in a lot of different ways, especially in kids. Sometimes it'll come out as an attention problem. Sometimes it'll come out as a sleep problem. Sometimes it'll come out as a learning problem. Sometimes it'll come out as a substance abuse problem. Later in life, sometimes memory problems. Actually, underneath the surface is a depressive disorder. I used to do a lot of work for a psych med unit here in town for dementia. And it was amazing how many dementia people that came in thinking that there was dementia going on, that underneath the surface it was really depression and some type of sleep problem that was causing the depression or causing the dementia. And when we fix that, what a difference this person would seem in a month. And so the great imposter depression is something that all of us, it touches all of us either directly or indirectly. Everybody knows somebody that's dealing with depression. And in your offices, many times, if somebody has a medical illness, there's going to be an overlay of depression. So how does HRV have such an impact on depression? Well, we've known, and you look at the literature, we've known back to the 40s that depression and cardiovascular disease are closely linked. And we know that it's always been assumed, I used to do a lot of work in psychiatric facilities in the early 90s, that we know that the people that have major depressive disorder, that they're at a much higher risk for cardiovascular disease. I mean, those two have been linked for a very long time. So we know that depression, major depressive disorder, and some type of cardiac disease, that those two they're linked, okay? That everybody talks about that. And so we're always watching those kind of things. But it's very interesting, and everybody, always thought, well, the major depression leads to the cardiovascular issues. Very interesting. A group of cardiologists in the early 2000s started to ask the question, what about if it was the reverse? What about if there was something related to their cardiovascular system that actually predisposes them for major depression? Fascinating question. And if you just Google this, you're going to start to see, since the 2000s till now, study after study after study that's looking at actually the reverse link, and particularly heart rate variability and its connection to major depression. Fascinating, right? So let's talk about why this might be the case. So in this initial study, they looked at taking groups of people with major depressive disorder and no treatment, traditional SSRI treatment, and HRV. Clearly, initial studies showed if you taught the person HRV, they had a much better outcome than either of the groups. Okay, we know that. Okay, and that's been shown over and over again. So just being able to teach somebody how to do their HRV is super important for their overall cardiovascular health. Okay. So you like my eraser? That's pretty weak, huh? So let's go ahead and look at what's happening here. So when we look at coherence, which is the interbeat interval of the heart where it becomes more varied. So it's really, we talked about this last time, that if I took 60 seconds, maybe we didn't talk about this last time. If I took somebody who has a heart rate of 60, okay, a pulse of 60, and I looked at their interbeat interval, okay? So when is the heart beating, okay? And I count these, I could have somebody who has a second between every interbeat interval, right? And in 60 seconds, they have 60 beats, and the span is always 1 second, okay? Very rigid, okay? I can also take another person who has a heart rate of 60, but the span is wide, shallow, wide, shallow, shallow, wide. And these beats, the inner beat, or what's referred to as the IBI, the interbeat interval is changing in a very rhythmic way, okay? And this one might be 0.6 seconds, and this one might be 1.3, and this one might be 1.5, and 0.6, and 0.7, and 1.3. So you get the idea. Varied, but same heart rate. Which of these two, A or B, is a more resilient person? Which of these two actually is going to be more prone to depression? Which is going to be more reactive when things change in their environment? The one that's going to be more prone to depression is this one. The one that's going to be more reactive to their environment is this one. The one who's going to have more resilience, okay, and is going to be able to adapt better is B, okay? At first glance, I'm like, man, that doesn't make sense, but you need to understand what's going on here. Because of the interbeat interval being varied, when I introduce stress, okay, which of these two gets impacted by any slight change in the environment? This one, because it's such a rigid interval that it has any little bit of stress impacts it in a negative way. This one, if I add stress, it's able to flex. So the way I like to look at this is, this guy is like a rubber band that's very tiny. And then this one has a rubber band that's big, okay? So when I introduce stress, this one, I hit that mark, and all of a sudden I'm in a sympathetic state. This one, I can put stress in there, stress, 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 and it can manage it, okay? That's why we can take people who are in very stressful situations and teach them HRV, and they can manage stress better. Super, super important. So now think about what we talked about with depression. If I've got somebody who has low coherence or low HRV, okay, and I introduce stress to them, every little thing is a life crisis for them. They're in the same traffic jam as somebody else, but for them, their heart is racing, their head is spinning, their skin temperature is changing, the skin conductivity is changing, the digestive system is changing, the adrenal system is changing, because they're not able to flex like the person who has high heart rate variability. So giving the person the skill to be able to do HRV can be life-changing for them before we even get into the EEG feedback. And that's why we really want to emphasize this HRV and make sure that we're really solid on it. Okay, let's go ahead and we're going to do a little demonstration today. And I've been talking, so we'll see how well I can actually do this, coming right out of a lecture format. Okay, so I'm just going to breathe. At the bottom, you're going to see breathing and heart rate. And then at the top, you're going to see all the different frequencies at which the heart is working. Okay? So let's go ahead and start. You guys can breathe with me too. I'm the yellow line, okay? In and out. Keep it very smooth. The white is my heart. Can you pause it? Okay, so I want to show you this before I get to the screen that you're used to using, okay? So I've got my breathing going on, which we know that the vagal nerve and the cardiovascular system work in an optimal fashion, okay, when we're breathing right at 6 breaths a minute, okay? That's really where the system functions at its best. So we don't have the number up here, but I can tell this is a 30-second time frame, and I've got 1 breath, 2, 3. So I'm probably breathing about 7 breaths a minute here, okay? Now, if I was doing a critique of myself, I'd say, hey, the height of this breath is a little bit lower than that, okay? And that's really important. I need that to be the same. So I'm going to be slightly off there. Now, when I look at the different frequencies at which the heart is working, which is happening up here, we're going to divide it into 3 bands, okay? This is called VLF in the heart, okay? Or the very low frequency, okay? This has a huge impact when you see high volumes of VLF for long periods of time on more chronic type illness, okay? This low frequency percentage is what feeds into our coherence. So when this guy gets really high, okay, that coherence bar is going to shoot up. But it is a blend of a few different frequencies for the heart. And then this one is the high frequency percentage, okay? And this one's more associated with more immediate stress, anxiety, sleep problems, post-traumatic stress. So ideally, we want this thing to be as flat as possible, and we really want this to look more like this, okay? So these will be super, super flat, a peak here, and then it would come down and nothing here, okay? If I did that right there, that would give me a coherence of probably about 85 or 90, okay? But the coherence is coming from the adjustment of the heart and the autonomic nervous system to get rid of all these high frequencies and to get rid of these very low frequencies, which are parasympathetic. And it's driving us right into that perfect balanced blend of frequencies, okay? Now that's a lot for anybody to digest. So we want to make it a little bit simpler. So let's go ahead and we're going to look at the other screen, okay? And I just need you to remember that the high frequencies are a combination of frequencies that are stress. So of course, the higher I am here, the much greater the stress than if I was high here, if that makes sense. Great resource for learning all about this, if you want to dive in super deep, is to go to Heart Math and start looking into this stuff. And you will be amazed at some of the different things that you're going to find out that this is all related to, okay? So this is definitely more stress than this, and this is more calm than this would be, okay? So let's go ahead. Now we're going to go to a screen that gets closer to what you're normally seeing. This time on this next screen, I want you to breathe with me, okay? And so I have this little pacer up here, okay, that you can follow the little ball, and I want you to push your stomach out as the ball goes up and then pull it back into your spine as the ball comes down, okay? Then we're going to represent all those frequencies in some horizontal bar graphs that you're going to see, and we'll walk through that in a second. Over here is going to be my respiration rate and my heart rate. Initially, the first minute or so, the heart rate will bounce all over the place, but once it starts to figure out exactly what my rate is, it'll get more precise, okay? So here we go. Let's take a look at this. Just breathe with me, okay, for about a minute to a minute and a half. Actually, let's go 90 seconds. I think we can all afford taking 90 seconds of breathing. And let's go ahead and breathe, and then I'm going to break down the screen for you. Okay, so here we go. Okay, good. You guys did good. Hopefully you were breathing with me. So now we're going to look at the chart slightly differently. First, let's do our basics. I always ask my patients, hey, what's the screen telling you? Okay, like I want them to engage with the screen. So I don't like, hey, here's everything is showing. I always want them to start with, what do you see on the screen? What's this telling you about yourself? Just like if you're in your car and you're looking at the dashboard. What is the dashboard? So we need to get our clients active with the screen. So I'll say, hey, look at the screen and tell me what you see. And most people will say, well, my respiration rate is 5.52. Great, perfect, nice. Heart rate, 66, that's my pulse. So that's good, right? Then they might look, qualitatively at the breathing and the heart rate. And they would say, hey, I'm starting to breathe in such a way that the heart is actually following my breathing. So if I'm really working on how do I efficiently make electrical current and not overuse it or underuse it, I'm making the heart, which runs off of electrical current, work in a very efficient way. Now I've got a slight little drop here, okay, which is primarily stress-based, and you can see it happening time and time again, okay? If I wasn't talking and, working through this, that would probably smooth out at the top and line up perfectly with the breathing. So I want to look at it qualitatively. What I do like is look at the heights of the breath there and the bottom of the breath. Nice, good amplitude and symmetry, which is keeping me at a rate of 6 breaths a minute. Now, what I did up here was, before we saw all the fast frequencies, which are related to sympathetic, right? And we saw all the low frequencies, which were related to parasympathetic. Well, now what I've done is we've combined them all into a percentage so that I can see, well, how much slow, how much fast, and then how much of that perfect resonance or coherence, which correlates with decreased depression, decreased anxiety, improved sleep, improved focus. And what we can see here is that I am coming more towards the middle with maybe 5% parasympathetic, 7% sympathetic, but really I'm staying in that band in the middle, which is a very, very good thing. And eventually you can see on this screen is that when you get above this line up here, that it turns the color of yellow. When it was below it, it was gray. So that tells me, hey, you're getting really close to that 80 mark, which I did, okay? So qualitatively, that's, and quantitatively, that helps out a lot. Let's see if I can, no, it wouldn't show it there. Okay, no worries. Okay, let's go ahead and we're gonna finish out with just a couple recommendations. So one is, I'd like all of you to be practicing your breathing this next week. Even though I know you're working with patients and clients and all that kind of stuff, I want you to personally, as part of this team, is to really, really work on your breathing. And then I want you to, those of you that want to dig deeper, think about getting into the Heart Math website and digging around there, because that's really where you're going to find the answers to how this kind of stuff happens. And then I'm going to go ahead, and in case you didn't do these last week, I really want you to look at these. Especially, I want you to read this one right here, okay? This one right here, okay? The Rob Bell one is primarily about HRV, okay? And you need to listen to this story. If you experience any form of stress, or you have patients that are experiencing that, this guy's story is fantastic. So really recommend that. And then Kirk also in this one that we'll use from last week does talk about how he uses his breathing and those kinds of things. Okay, so let's go ahead and finish up. Does anybody have any questions that you would like to ask, or any comments? Comments are always helpful. Do you feel like we're going too deep, that we're not deep enough? So maybe if you could just give me over in the chat message, you should have a chat. Just tell me, give us a little bit of feedback. We're going to end a little bit early here, but if you could, any comments, questions, just overall feedback would be helpful.
I think I don't know exactly how to always teach this, and some of our patients are getting frustrated that they're not as successful as. That helped a lot today, seeing, I love that graph that's on the top and teaching them a little more about that. But is it really that they just need to go home and practice?
Yeah, good question.
Yeah.
So there's a couple different things here. Is you have to, if there's some people that right out of the chute, they're just rock solid, because they have good biometrics, and they're typically athletes, or they're people that have done things with their body throughout their life. And so I show them, hey, that line's your breathing. And they're like, oh, sure, that line's my breathing, right? Somebody else, you say, that line is your breathing. And they're like, what are you talking about? Like, how is that my breathing comes out my mouth? How could it be? on the line, right? And so that is, you first have to assess that, like, what kind of person am I dealing with? And usually these athletes, they get it right away, but sometimes I've had athletes that don't. Now, the average person out there can do it just as well too, but you got to assess. If they're pretty anxious, they're going to start to overanalyze things pretty fast, and so you want to put it in bite-sized pieces. So the first place, hands down, over and over and over again, and you would probably laugh at how many times I've done this, is I notice the person that's struggling, and I immediately lay down on the floor in the office, and they're like, "What are you doing?" I'm like, "Lay down. You don't have to lay down on the floor, but I'm going to lay down on the floor, and I want you to watch me do something." And so they'll be like, "What's the doctor doing down on the floor?" You know, no, I'm lying down on the floor, and what I'm doing is I'm getting what's hard is these mechanics, the intercostal muscles, the spine, and all that stuff have to work together to get that stomach out, right? So you have to like really hold that nice and rigid to move that stomach horizontally versus working vertically. So what I do is I lay down, okay? Now everything's supported. I can't go through the ground, right? So I'm laying down here, and then what I'm gonna do is I put something on my stomach, whatever's in the room. I pick a book, you know, I take anything, and I just stick it on my stomach. And I put it on my stomach, and I push that up. I said, watch this, I'm gonna push the book up. I'm not even thinking about breathing. Just push the book up. Then down. If I got a 5-year-old or a 6-year-old, we grab a little stuffed animal, okay? Let's move the stuffed animal up and down, okay? It doesn't matter. Something that's fun, or a little pillow or something, right? And I move it up, and I move it down. And I keep getting that belly up, belly down. That is the easiest way to learn to breathe. And I have 4-year-old autistic kids that I can teach to do this, okay? But you have to first start, they need all that body support.
Okay.
They get that and they're doing that, and you send them home and say, every morning, every night, middle of the day, lie down and push that stomach in and out. Then, now let's get in the chair. And a lot of these people are very slouchy in the chair, and what they do is they create a big gap between the small of their back and their chair. And in doing so, then it makes it really hard to get the stomach in and out. So I always give them a chair with a nice, good back, and let's get the small of my back up against the chair and create that back support. So now that I can work in and out. If I don't have that back support, it becomes really sloppy. Then for the tough breather, the other thing that we do is we teach them to not worry about their breathing, but to only worry about their movement of the stomach. So can you share the screen, Elise? So what I might do is, in the case of the difficult breather, is I need them to make this shape with their breathing more than I need them to actually breathe. Because I need to create the cavity that's symmetrical, that's symmetrical, so that when they do start breathing, that it allows them to, that it allows them to breathe correctly, okay? So what I'll do is I'll go here, okay? And we'll go back to their training screen. And I'm not even going to breathe in and out here. All I'm going to do is what I call paint with my stomach. All I'm going to do is move my stomach out and in, and I'm going to use my muscles, always muscles before breathing. I'm going to use my muscles to move my stomach. And in this case, you wouldn't have this, but I'm going to make a slight change here. I'm going to put a little grid on here, actually. Okay, I don't know if you can see those lines on there. Okay, yes. So I put these little white lines on there so that now I'm going to say, I want you to hit the same spot on the graph paper every single time with your inhale and or not even your inhale, exhale, just to move your stomach out and move it in. Don't even think about breathing. So here I'm going to watch the yellow line is I'm not really even going to be inhaling and exhaling. I'm just going to move my belly. So, and I find a spot. And now I've got my bottom spot. Now I'm going to go find the top spot again. And I'm not breathing.
Nice. Yeah.
I'm just moving my belly, right?
Mm-hmm.
And some people, you have to start here where it's like, just move your belly and keep it smooth. And land at the same spot. Okay. Or we'll draw them that shape on a piece of paper in front of them and say, make that shape on the screen. So these little kids that you'll see on all their tables in front of them is they have a little piece of paper that has this exact design on it. Mm-hmm. And they're trying to make that design. I'm making this design right now as I'm talking to you. Okay, where that's really hard if it was just breathing, but I'm just moving my stomach, right? Now, once I'm good at this, now I'm going to layer the breathing on. And the breathing is always going to follow my movement on the stomach.
Yeah.
Inhale, move the stomach. Exhale, pull it in. Okay. So if they don't move the stomach correctly, you're starting off on a poor foundation. So I'd much rather get the person, don't worry about how much oxygen you're taking in and out. Just make this shape first. And it is amazing how just making this shape, and they're not even thinking about breathing, their coherence will go off the chart because the body will figure out the rest. Okay.
Yeah, that was
Let me see. Let's see.
Hey, Doc.
Yeah.
This is Steve.
Yeah.
Just following up on Dr. Julie's comment. A couple of things that we're encouraging in our clinics is that they do 3 minutes to 5 minutes of HRV every single time before any of their EEG sessions, not just
Absolutely.
in the EEG. That's number one. And second, the other thing that we found that's successful is downloading a breathing app on the phone for the patient and putting it up against the screen, and they look at that and follow that, and then they end up painting properly. And then they can take that home and practice. And, we encourage our clinics to coach the patients 3 times a day, breathe for 3 minutes.
That's fantastic. That's right on point. I would echo that. There's a great app called Heart Rate Coherence Plus that actually, you can see this, looks like this. Okay, now I'm going to start it. And you see the little pacer there for breathing? Okay, can you guys see that? Okay, now watch what happens. I'm going to use this app, which also takes the light from the camera and reads heart rate variability off your finger through the light, okay? So I'm going to have this go for a second, and then you're going to see something on the screen that you've seen before. Okay, so what happens on here, just had it. You can see that little bubble started coming up on the screen. And you know what that was? That was coherence. So you get the exact same, the heart is in coherence. And then you remember that full spectrum graph I showed you earlier? You can slide the screen over and you can literally see the full spectrum of all the heart rate going on through this app. It's great. Heart Rate Plus. Okay? Let's go ahead.
Heart Rate Plus?
Yeah, Heart Rate Coherence Plus.
Plus.
Okay?
Okay. Okay.
Great thing to practice when you're out there. Of course, the more advanced technology is good to learn, and then from there, use something like that on the road. Okay. Great meeting with you guys. Let's do some reading on some of the things we talked about. This can be life-changing for a lot of people. Really want you to have this down. And next week, we'll go into the EEG some, okay? Or we'll actually start a long journey into the EEG.